Hi, this is Jesse Whitson. This is my fall 2019 parent meeting athletics risk video. First of all, we want to discuss the risks involved with athletics with our parents and athletes in order to make sure that all of our parents and athletes are aware of the risks involved in participating in athletics. We want to inform our parents and participants about the strategies, policies, and procedures that can be used to prevent injury and minimize risk in the athletics programs. Specifically today, we're going to be talking about heat-related illnesses, concussions, and serious injuries that may occur, and how we want to handle them as a staff if they do occur. We also want to talk about how we can aid our athletes in recovering from injuries that have occurred during an athletic activity. For starters, the first thing that has to happen is that every athlete and participant must submit a MSHSAA pre-participation physical form before participating in any practice or activity. In order to do this, they can go online and go to the MSHSAA website, grab the 2019 MSHSAA physical form, and have that filled out and performed by a doctor or physician. Then they need to turn that into our athletic office, and once that has been filed properly, that athlete will be cleared for participation in tryouts or practices. Alright, so communication and treatment of injuries is very key in our system here. For starters, if an injury occurs, whether it is dealing with a sickness, whether it is dealing with a concussion or another bodily injury, number one, the athlete needs to communicate that to the coach. The coach cannot help the athlete if they are unaware that the athlete is suffering from an issue. The athlete and coach will then approach the trainer and communicate what is going on. The trainer will then be able to proceed from there. If an injury has occurred, then the trainer will then begin communicating with the coach the procedure for how they will go about helping the athlete and what the rehab situation will be as well. All of our coaches are CPR and first aid certified, which is important because we do have trainers on site for all practices and games. However, we only have one at a time at our school, and therefore it's important to note that the trainer may not be there immediately to help them. The coaches are certified in order to do that, and therefore they will also work and coordinate in order to help the athlete immediately with the first aid and first response to the issue, and then with the rehab as well. Alright, heat-related illnesses. This is especially important for our outdoor fall sports. They will follow what is called a 16-day acclimatization period that MSHSAA has put in place. This helps them progress through the length of practices and how many practices they can do per day over that 16-day period. This is put in place in order to help them acclimate to the weather, especially in the Midwestern heat and humidity. That will hopefully help prevent exertional heat stroke, which is one of the leading causes of death in high school athletics. It's important to note that this acclimatization period will reduce but not fully eliminate the risk of heat stroke. Therefore, it is important for our athletes to understand that hydration is one of the biggest things that they can do to help prevent this issue. Before, during, and after, hydration is vital to their health, and their coaches will be communicating that with them further. And they need to listen to those and follow those guidelines properly in order to lower the risk of heat-related illness. Next is any serious injury that can occur. Injuries can occur at any time, whether it's in practice, competition, walking into practice, walking out of practice. These injuries can be minor. They can be stitches or something along that, a twist of a joint or something. They could be major. They could be torn ACL. They could be broken bones. They could even become life-threatening. Concussions at times, broken necks, unfortunately, have occurred in contact sports such as football and wrestling. And it's important that our athletes are aware that those issues can occur. If they are not using proper techniques in their activity. It's also important for our athletes to follow the procedures that we talked about earlier about communicating their injuries in order to minimize their injuries and respond to them in an appropriate time and manner that can minimize the damage done by those injuries. Concussions are an especially hot topic nowadays. Concussions and concussion protocol is our next topic. So, for starters, all students will undergo impact testing. This gives our trainer and doctors from Centerpoint Hospital a baseline of their brain function and what their normal function is like, so that if a concussion does occur, they are able to refer back to that in order to determine when they have fully recovered from a concussion. Just briefly, a concussion is any type of traumatic brain injury that impairs the normal function of the brain. We'll talk about symptoms in a minute. As opposed to the old way of thinking, concussion does not have to occur from a knockout. It can happen and occur from a mild jolt or blow to the head. And so it's important that everyone involved, coaches, athletes, parents, trainer, know what some of those symptoms are. So some of these signs and symptoms are loss of consciousness, seizure, headache, vomiting, dazed or stunned. But it's important to know that loss of consciousness does not have to happen in order for a concussion to have occurred. For an athlete, things that they may be feeling: headaches, nausea, vomiting, dizziness, sensitivity to light, problems with concentration, confusion, and lack of emotional control are all things that can indicate that a concussion has occurred. If that is the case, those issues need to be communicated with the coach, who will then communicate with the trainer. Our trainer here at Green Valley High School will then work in conjunction with Centerpoint Hospital in order to approach the recovery process for the athlete. This is our return to play procedure. Once the athlete is seen by the trainer will refer them to Centerpoint Hospital, and the doctor there will basically give them the baseline of how long they need to rest for, when they can return to learn, which is our return to school policy with them. That may be half days, it may be full days, and then when they can return to play, which is return to activity. That will be a slow, gradual return where they come back with light activity and gradually increase back to full activity, full involvement in their sport. Again, it's important for everyone to be involved in the communication process here and make sure that we are following these procedures correctly in order to ensure the safety of our athletes. Failure to follow these procedures properly could result in another TBI, traumatic brain injury, which could result in permanent damage and even possibly death. So it's important that we are following these properly. Risk of facility and equipment use. This should go without saying, but all athletes need to use our facilities and equipment as properly instructed by our coaches. Failure to do so could lead to injury, and students should only use these equipment and facilities when they are being properly supervised by a coach and adult on campus. Lastly is our severe weather section. Obviously here in the Midwest we deal with lightning and tornadoes at times. If those types of weather do occur, our staff have been properly trained in what actions should be taken in order to ensure that our athletes are not injured in any type of severe weather situation. Finally, just to recap our goals of this: making sure that we are working together to prevent and minimize risk as staff, training staff, parents, and athletes. Working together if an incident does occur, and then working together through the rehab process. Thank you for your time today. This has been our presentation on risk involved in participation.